In this video by deckplate we will understand the VA disability ratings for mental disorders, other specified somatic symptom and related disorder, unspecified somatic symptom and related disorder, conversion disorder, functional neurological symptom disorder, illness anxiety disorder, cyclothymic disorder, bipolar disorder, persistent depressive disorder, dysthymia, major depressive disorder, unspecified depressive disorder, chronic adjustment disorder. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. When it comes to veterans, mental health conditions are evaluated under specific diagnostic codes, and each condition can impact one's ability to work and function in society differently. Here is information about the mental health conditions and their corresponding diagnostic codes. Other specified somatic symptom and related disorder, diagnostic code 9422. This condition involves excessive focus on physical symptoms, where the individual's concerns are not fully explained by any medical condition, but they cause significant distress or impairment. Unspecified somatic symptom and related disorder, diagnostic code 9423. Similar to specified somatic symptom disorders, this diagnosis is for individuals who present symptoms that don't meet full criteria for any specific disorder but still cause disruption in daily life. Conversion disorder, functional neurological symptom disorder, diagnostic code 9424. This disorder involves neurological symptoms, such as paralysis or seizures, that cannot be explained by medical conditions, and are thought to stem from psychological distress. Illness anxiety disorder, diagnostic code 9425. Individuals with this disorder have an overwhelming fear of having or developing a serious illness, despite having little to no physical symptoms, leading to significant distress and healthcare overuse. Cyclothymic disorder. Diagnostic code 9431. This is a mood disorder involving chronic fluctuations between hypomanic and depressive symptoms that are less severe than those seen in bipolar disorder, lasting for at least 2 years. Bipolar disorder. Diagnostic code 9432. Bipolar disorder is characterized by extreme mood swings, including episodes of mania, elevated mood, hyperactivity and depression, significantly impacting an individual's daily functioning. Persistent depressive disorder, dysthymia, diagnostic code 9433. This is a chronic long-term form of depression, with symptoms of low mood lasting for at least 2 years, leading to difficulty experiencing joy or maintaining regular activities. Major depressive disorder, diagnostic code 9434. Major depressive disorder involves persistent and intense feelings of sadness, hopelessness, and loss of interest in daily activities, severely impacting an individual's quality of life. Unspecified depressive disorder, diagnostic code 9435. This diagnosis is used when depressive symptoms are present, but do not meet the criteria for major depressive disorder or another specific depressive disorder, yet still impair daily functioning. Chronic adjustment disorder, diagnostic code 9440. Chronic adjustment disorder occurs when an individual struggles with emotional or behavioral symptoms following a stressful life event, and these symptoms persist for an extended period, leading to difficulty in coping with daily responsibilities. The VA uses the same general rating formula for all these mental disorders, assessing them based on their severity and impact on occupational and social functioning. 100% rating. Total occupational and social impairment, due to such symptoms as gross impairment in thought processes or communication, persistent delusions or hallucinations, grossly inappropriate behavior, persistent danger of hurting self or others, intermittent inability to perform activities of daily living, including maintenance of minimal personal hygiene, disorientation to time or place, memory loss for names of close relatives, own occupation or own name. 70% rating. Occupational and social impairment, with deficiencies in most areas, such as work, school, family relations, judgment, thinking, or mood. Due to such symptoms as suicidal ideation, obsessional rituals which interfere with routine activities, speech intermittently illogical, obscure, or irrelevant, near continuous panic or depression affecting the ability to function independently, appropriately and effectively, impaired impulse control, such as unprovoked irritability with periods of violence, spatial disorientation, neglect of personal appearance and hygiene, difficulty in adapting to stressful circumstances including work or a work-like setting, inability to establish and maintain effective relationships. 50% rating. Occupational and social impairment with reduced reliability and productivity, due to such symptoms as flattened affect, circumstantial, circumlocutory, or stereotype speech, panic attacks more than once a week, difficulty in understanding complex commands, impairment of short and long-term memory, impaired judgment, impaired abstract thinking, disturbances of motivation and mood, difficulty in establishing and maintaining effective work and social relationships. 30% rating. Occupational and social impairment with occasional decrease in work efficiency and intermittent periods of inability to perform occupational tasks, although generally functioning satisfactorily with routine behavior. Self-care and conversation normal, due to such symptoms as depressed mood, anxiety, suspiciousness, panic attacks weekly or less often, chronic sleep impairment, mild memory loss such as forgetting names, directions. Recent events. 10% rating. Occupational and social impairment, due to mild or transient symptoms, which decrease work efficiency and ability to perform occupational tasks only during periods of significant stress. Or symptoms controlled by continuous medication. 0% rating. A mental condition is formally diagnosed, but symptoms are not severe enough either to interfere with occupational and social functioning, or to require continuous medication. Thank you for watching this video. Please don't forget to subscribe and like our videos,